So today we're going to be talking about facet joints.
Facet joints? What are facet joints? Hannah.
Facet joints. Facet joints are the joints in your spine, so they allow the bending and twisting motion within your spine.
So they've been like this?
This way,
So articular motions, rotations.
this way,
Can they twist?
a little bit,
A little bit?
that way, a tiny bit, they allow some movement.
So they're on the spine, and we're on the, so if this is the vertebra, where are they?
They are...
If this is facing you.
Okay, so it's...
I'm a smiley guy.
So if it's facing that way...
If your spine smiles at anyone, run. What a great... Everyone's going at faces. Okay, so...
This is your spine, and...
Actually, the knuckles are perfect,
Yeah.
aren't they? Because they kind of...
So in your spine, each little segment, each vertebra,
Bony prominence of the spine.
there are two joints. It's made up of two joints, and then within, so that goes all up your spine, and then they are then covered in cartilage, so each joint can move smoothly against each other. They also have synovial fluid running throughout each little capsule. Tell me more, Dan.
Tell you more. So they mainly do flexion, like forward and backwards movement. There is slight sideways to them. Synovial fluid is essentially a fluid that makes joints move more, kind of like an oil in a car, I guess. Makes the bones rub nicely against each other. And then what can happen is when you're younger and you're healthy, you have nice rounded facet joints, and then generally as age comes in, they get more jagged and they wear down as time goes on. Liz giving me that.
No, I just have a question. Does it wear down on everyone?
That is a good question,
That's
Liv.
my question.
Does it wear down and you don't notice though? Or does it wear down on everyone and and you don't notice? Or does it not wear down on everyone? I guess it's the opposite.
Wait. Say that again.
Is it that it wears down on everyone and some people get pain and some people don't? Or is it that some people are more genetically programmed to them wearing down? Or a mixture of both?
I think in terms of dysfunction, it's not going to be the same with everyone. Some people might have slight wearing, but it won't necessarily disintegrate. Of course, sort of putting aside things like osteoporosis and things outside of just normal general movement segments in the spine. But I don't, that's something I'll need to research as well.
I think in general that's a good thing we can all research.
Mm-hmm.
When you say dysfunction, what would be dysfunction? Is it just the breakdown of the facet joint, like the end of the bulb of it, or is it?
It can be a lot of things. Sorry, I'm looking down. Dysfunction can look at very different for a lot of different people in terms of, like I said, osteoarthritis. I've forgotten the other ones. In very rare cases, gout can break down the actual capsule itself, which is going to cause bone-on-bone rubbing, and you're going to find adhesion. It's going to cause adhesions in the muscles surrounding, as well as inflammation in the area, as well as a lot of pain because you've got bone-on-bone rubbing. And from that you can get things like compressed discs and what's called a tropism of the vertebra, which is where one vertebra rotates from the rest of them or protrudes slightly. In terms of palpating, you'll feel a bony prominence sticking out when running your fingers down the spine.
Alrighty.
Yeah.
And this lovely word, multifidus.
Multifidus?
Multifidus. How important is that in, well, the spine itself, but in particular in the facet joints?
Well, extremely important as it stabilises, I guess, the whole spine and all the individual little joints.
Where are you most likely going to feel pain if you've got facet joint problems?
Well, it's all going to be different depending, I guess, on the area. So if it's the...
In general, let's just go
Okay.
general. Two most common spots people will feel pain on the spine. Well,
so shoulders and upper back, I guess, and then hips and groin
Okay.
Yeah, no?
I would have said neck and lower back. Personally. What do you think?
I do think.
Would you like to contribute?
No. Maybe I do. In terms of facet joint dysfunction, I know that the nerves of the cervical spine, yeah, that's the right one, affects things like headaches, neck and shoulders, just on a nerve level, as well as upper back and mid back, whereas the lumbar spine contributes to a lot of lower back, hip, posterior of the thighs, down into your hamstrings, and can lead to lower if severe enough dysfunction is present. But I'd say, yeah, head, neck and shoulders as well as lower back would probably be two of the most common.
How do we ourselves help people keep doing the right things to make them feel better? Or what advice can you give to someone?
If it was a facet joint dysfunction, which is what I presume you're asking about, as opposed to just generalised pain, is that what you were asking? Okay, but thought I'd just specify to...
It can go across.
It can. So in terms of facet joint dysfunction, if someone comes to me with that, I would, in terms of the way that my therapy approaches the body, I would relieve the tension in the adhesions and trigger points that are in and around where the dysfunction is actually happening. There's a lot of different modalities depending on the person that comes. We could use something like myofascial cupping, Graston technique, like a cross fibre friction release. Yeah, that part depends on the person, and then you can go into some sort of mobility, whether it be lateral mobilisation of the actual joint itself, or whether sometimes if there's a dysfunction in a facet joint in and around the cervical, you can actually utilise the trigger points to help reposition the facet joint itself. And this can take a matter, it's not going to happen in one session. There are a few people that have taken 5, 6, 7 sessions to actually just get one joint to start moving again, not necessarily even back in place, but you can help improve the function of it by simply taking some of the fascial and the muscular pull off and around the area. By relieving some of that, you can actually help the way that the joint's functioning itself. But how would you guys approach it in terms of your guys' style of therapy?
So in terms of stretching, or even strengthening as well, to some degree, there are plenty of low resistant exercises that you can do to help, as we said before, the multifidus, helping those muscles. So that will in theory help the whole back engage better, and in particular the facet joints. We can also do a sort of standard stretching out the back to open up the distance between the vertebrae, so you can then get more movement that way.
So with my style of treatment, so a fluid-based treatment, it's great to loosen up all the sort of muscles around the spine, stabilising the spine, and allows all the fluid, synovial fluid, to sort of work its way through the spine, I guess, and relieve all the tension and the pain in that area. And so I guess overall just relieving pain, stiffness, tension, increasing better range of motion. Yeah.
Mm-hmm. And also in terms of, I think, any of our styles of therapy or mobilisations or stretching, it's also about the circulation that you're able to get to the joint. When there's dysfunction and trigger points, everything gets constricted and tightens down and stuck essentially. And so in terms of the area of dysfunction as well as the muscles surrounding, nothing's going to recover as fast because there's just not the same amount of circulation going to the area or movement because of the adhesions. So any of the modalities talked about by any of us are all going to be beneficial in terms of allowing it to heal faster by getting it moving, whether it be stretching or mobilisation, fluid-based treatment, or whatever I do. What's the word?
That is brilliant.
Structural
And whatever I do.
Us three. Whatever we do.
Whatever we do, it happens.